Alright, this is the video for the sauna horror story. This video is about sauna therapy, what could possibly go wrong, and how you can stay safe using sauna in your life. Welcome to my YouTube channel. I'm Dr. A and I talk about holistic and integrative treatments for chronic illness. So let's dive into the topic of a horror story happened to a patient of mine. Thankfully it all turned out well, but it didn't go so well for a while. This was one of my patients who is chronically ill, and they'd been improving over time. We've been working together probably 5-6 years at this point, and everything was getting better in baby steps, as it does with chronic illness often. So without me knowing, or anyone at the office, on his own, he started feeling better and he wanted to be empowered and kind of do some new things, to help out. And he started reading about sauna therapies and he started to get into that. Fair amount of resources. He went and got a really nice sauna and he started to use it, which was fine. It's just that he kind of thought it was plug and play. Heard some friends tell him, do this, don't do that with the sauna. And he started to do sauna, and then he came in one day for his follow-up, and a lot of the things we've been working on had suddenly gotten worse. And so generally when that happens, the first question that your healthcare provider probably will ask is there anything different? So that could be, are you on a new medication? Did you have an injury? Was there a large shock in your body? Has your diet changed? Any number of things can happen. Well, when we talked about what was different, the only thing that was really different is he told me the story about this sauna that he got. And he was noticing that he was into saunaing, and he would go in, he would do a certain amount of time, and he would kind of feel pretty rough the rest of the day. But he really was committed to this idea that the sauna would help him. So he'd get in there the next day and he'd feel pretty rough in the next day. And what happened was, over time, he basically just went downhill and regained a lot of his bad symptoms. Let's deconstruct what happened to him. Now, as I said, it all turned out well in the end. We all learned things from it. It turned out to be a really great therapy for him. But what did we learn? So what is it that we figured out that he wasn't doing quite right? Well, the first thing is with sauna. Now, if you're used to sauna and you go in, maybe you go in at the gym or you got one at your house or friends or whatever, and you're used to doing it 3 or 4 times a week, and you're up to, 15 minutes or 20 minutes or 30 minutes, great. Because you know what your tolerance is. Well, this was a chronically ill person who was just regaining a lot of his strength, and he had still a fair amount of toxicity he'd been exposed to, etc. And so one of the problems he was enduring was he was doing too much time in the heat in the sauna over too rapid an amount of time. And then that was compounded by the second problem, which was that he was doing sequential days, so every day, too quickly. So both the time and the frequency of his sauna use was just not a bad thing, but it was more than his body could handle. The next thing he wasn't really paying attention to, although he was trying, but as it turned out, it wasn't quite clicked in enough to it, was he was getting dehydrated from the sauna, which is one of the dangers of heat, is dehydration, obviously. So that was a whole other issue that was going on. One of the things that we did as we're trying to deconstruct, well, how far off the road did we go here with this sauna experience, is we did some basic labs to make sure his kidneys were working well and his electrolytes hadn't, gone out the window as far as balance and all of that. But we also did some basic screening to see if his baseline levels of, say, metals and some of the chemical toxicants had. And so thankfully his kidneys and his liver and his electrolytes, that stuff was all normal. So that was great. But the toxicants had started to move around in his body, because it's one of the things that heat does in your body, is start to move the toxicants around. And so his body was suddenly experiencing an increase in the amount of circulating toxicants, and that was both of the metal category and and chemical. Now, heat generally helps both of those. You can go back to some of the other YouTubes I've done about heat therapies and toxicity. One of the things that can happen is you start to move the toxins around, and then your body's eliminatory ability to get rid of that junk is not supported enough. And indeed, with this guy's case, he kind of had it all over as far as trouble getting the stuff out. Dehydration is one of the biggest reasons why we recirculate toxins. We can't get rid of them, etc., for a number of reasons. He was dehydrated. He didn't have enough support to move through the liver to the bile formation. Bile is a good way out of the body for some metals and a lot of chemical toxins. So the front end was working. You dump the bile into the GI tract, and then because his bowels had slowed down, he's not hydrated enough, you recirculate all of those metals and chemicals back into your bloodstream. So he's retoxifying himself. And the other thing which we would have talked about if he would have, come in beforehand, and we could have, prospectively looked at helping him out, was he just needed more support for all these things. So in addition to being more hydrated and getting his bowel movements regulated and all of that, what we needed to do also is to give him a little more support on the antioxidant end of the system, because parts of your phases of your detoxification require more antioxidants. So if I make the detox pathways work harder, I'm going to need more antioxidants. I'm going to need more binding agents, like fiber, etc., to help the bile leave, and all of these things. How did we so-called fix this problem? Well, what we did to fix the issue was we had him take a little break, get really well hydrated. While he was on this little break, it wasn't terribly long, 5 to 7 days, something like that. He got used to getting really hydrated. We got him on a little bit extra electrolyte support, some added antioxidants, and a little bit more of some fiber, and we kind of tweaked the diet, etc., to back those things up, and then made sure he was regular, so he was urinating and defecating regular schedule, and he wasn't slowing that down. And then when we had him go back into doing sauna, he had to start at 5 minutes every other day. So again, not sequential days, not jumping right up to 30 minutes. And then he could ramp it up to his tolerance. And what he found was that was not only much more comfortable, but much more effective, because over the weeks he was able to, kick his time up more. And on some weeks he would be able to do sequential days, so Monday to Thursday, as opposed to Monday, Wednesday, Friday, something like that. And it was well tolerated. So that was a very important thing. So these are the kind of things that can happen if you start to do sauna or other detoxification or depuration type therapies. And it's not that it's the worst thing in the world for most people. Obviously, before you do heat therapies like sauna, you want to check it out with your doctor, make sure that cardiovascular system and everything is ready for it. His certainly was. By slowing his process down, by giving his body a little more time to get into the heat therapy and the depuration, detoxification, and supporting him with things like electrolytes and antioxidants and fibers, binders, that sort of thing. It really took him from a horrible experience of getting sicker because he started sauna too heavy, to the sauna being part of him moving forward in his chronic illness and actually getting better. So it turned out well, but it started out pretty bad. I'm Dr. A. If you like this, go check out one of these other videos we put here. We try and put a bunch of links for you so you have a lot of options, and I'll see you on the next video.